Myself, Dr. ROSHIN CN, Assistant Professor, Department of Oral Pathology and Microbiology of Mahi Institute of Dental Science and Hospital. Today, I will be discussing about the dental anatomy of permanent maxillary central incisor. So, why it is called as incisor? In the Latin, incidere means to cut. So, the incisor shearing or cutting teeth, which has a major function to punch or cut the food material during the mastication. Difference between incisal ridge and incisal edge. Incisal ridge makes up the complete incisal portion of the crown. So you can see here is the incisal ridge. The term edge implies an angle formed by the merging of two flat surfaces. Therefore, incisal edge does not exist on incisal until occlusal wear has created a flattened surface lingo incisally, which forms an angle with the labial surface. This is the labial surface and this is the lingual surface. You can see here. So the maxillary central incisor is the widest mesiodistally of any of the anterior tooth and is centered in the maxilla, one on either side of medial line with mesial surface of teeth coming in contact with each other. This two in number. You can see here this is 1 1 and this is the 2 1. This is the permanent right maxillary central incisor and this is the permanent left maxillary central incisors. Is larger than the lateral incisors. So, coming to a tooth numbering system for the central incisor, the universal system you can see here 8 and 9. In Sigmund Palmer system is 1 1, and in the FDA system you can see this 1 1 and 2 1. So, permanent right maxillary central incisor is called as 1 1, permanent left maxillary central incisor is called as 2 1. Various surfaces of the teeth. So, the central incisor have labial, lingual, mesial, distal, and the incisor surface. You can see in this picture. This is the labial surface of the tooth, lingual surface of the tooth, and mesial and distal surface of the tooth, and the incisor surface of the tooth. Coming to the dimension, this is very important for carving the central incisor during the preclinical work. So, the cervical length of the crown is 10.5 mm. All measurements are in millimeter. And the length of the root is 13 mm and 8.5 mm is the mesiodistal diameter of the crown. These are average values. So mesiodistal diameter of the crown at the cervix is 7 mm. Lateral diameter of the crown at the cervix is 7 mm. Labial diameter of the crown at cervix is 6 mm. Curvature of cervical line mesial 3.5 and curvature of cervical line distal part is 2.5 mm. So these are the average measurements of the various dimensions of the maxillary central incisors. This is very important for carving the central incisors. Coming to the chronology of the maxillary central incisors, the first evidence of calcification is seen 3 to 4 months after 3 to 4 months. Crown completion is 4 to 5 years. Eruption takes place between the years of 7 and 8, and root completion occurs after 10 to 11 years. Moving on to the labial aspect of the crown. The crown of the average central incisor will be 10 to 11. I have mentioned already 10.5 is the cervical incisor length of the tooth. So 10 to 11 mm long from the highest point on the cervical line. So this is the highest point on the cervical line to the lowest point of the incisor. To the lowest point on the incisor line. So the mesiodistal diameter will be 8 to 9 mm. This is the mesiodistal diameter. The mesiodistal measurement where the root joins the crown. So here it will be less than 8 to 9, will be 1.5 to 2 mm less than that of the mesiodistal diameter at the contact area. So this is the contact area. You can see this is the contact area. Here the measurement will be 8 to 9 mm, but when it is going towards the cervical area, there will be a reduction of 1.5 to 2 mm in dimension. The mesial outline of the crown is slightly convex. The mesial outline of the crown. So this is the mesial outline of the crown. So this is slightly convex with the crest of curvature. Crest of curvature means the contact point. The contact point. You can see in this picture. This is the contact point. This is called as crest of curvature. So the crest of curvature approaching the mesio-incise line. So here the contact will be approaching the mesio-incise line. This is the mesio-incise line. You can see here. This is the mesio-incise angle. So the crest of curvature or the contact area will be towards the mesio-incise angle. And the distal outline of the crown is more convex. You can see here this is more convex when compared to the mesial outline. So with the crest of curvature higher towards the cervical line. So here the contact point will be towards the cervical line. So towards the cervical line. You can see this picture. The contact will be towards the cervical line. The distal incisal angle is not as sharp as the mesio-incise angle. This is one of the important features where we can differentiate the 1 and 2 that is maxillary right permanent incisor and left central incisor plus permanent incisor. So you can see here the mesio-incisal angle is more sharper than the disto-incisal angle. So the disto-incisal angle is not as sharp as the mesio-incisal angle. The incisal outline is usually regular. So you can see here this is the incisal outline. This is usually regular where the crown length is greater at the center. So the length of the crown is greater at the center. You can see here this here the length of the crown is more. The cervical outline of the crown follows semicircular direction with the curvature rootwise. So you can see here this is a semicircular shape or the outline of the cervical line is showing a semicircular pattern where the curvature or the direction or the curvature of the cervical outline is towards the root. So it's called as curvature rootwise. Okay. The root of the central incisor from the labial aspect is cone shape. You can see this cone shape. The relatively blunt apex. This is the apex of the central incisor. So the root of the central incisor from the labial aspect is cone shape with a relatively blunt apex, and the outline mesially and distally is regular. So you can see mesially and distally the outline is comparatively regular, and you can see development depressions. That is two straight shallow depressions which extend from the incisor layer. You can see here. These are the two development depressions, which is shallow and which extend from the incisor layer towards the gingival third and fade out in the middle. So this is the gingival one. If you divide the labial aspect of the central incisor, you can divide into gingival or cervical 1/3, middle 1/3, and the incisor 1/3. Let me see. Which is a two straight shallow depressions which extend from the incisor ledge. This is the incisor ledge towards the gingival, towards the cervical 1/3 and fade out in the middle 1/3. You can see the depressions only over the completely into the cervical or incisor 1/3 and partially into the middle 1/3. Fade out when it reaches the middle 1/3. You can also see imbrication lines. So they are faint curved lines which roughly run parallel to the cemento-enamel junction in cervical third and not always present. So these are called as imbrication lines. They are faint curved lines which follow the siege. Siege is the cemento-enamel junction of the tooth. So you can also see labial development group and the mammalions. These are the mammalions. Okay. Moving on to the lingual aspect, it is very important.